Good afternoon, guys. Today we are going to discuss regarding a small topic which is eye trauma. From the word itself, it's clear that it's a trauma to the eye. Maybe different types due to the cause or due to the occurrence of this trauma. It may be divided into different types, and we can see in detail. From this picture, you can see one of the example of the eye trauma, and can you identify which may be which of the types? And it is usually the type of penetrating injury, and we can see in detail of which of all the things. Mainly the causes and risk factors include domestic or industrial accidents, then assault, car battery explosions, sports injuries, motor vehicle collisions including the airbag injuries, then flying pieces of the wood, metal, glass, stone and other materials which are causing much of the eye trauma, then exposure to strong ultraviolet light as from the welding. These are the common causes and the risk factors. One is domestic or industrial accidents, and assault, car battery explosions, sports injuries, motor vehicle collisions, then flying pieces of the woods, metals or glass or stone, explosion to strong ultraviolet light as from a welding. These are the causes, and I think it's clear from the word itself. The first one is the mechanical injuries. Mechanical injuries means it is the contusional or the blunt injuries to the eye. A blunt impact may damage the structures at the front of the eye, that means especially the eyelid, conjunctiva, sclera, cornea, iris and lens, and those at the back of the eye also. That is including the retina and the optic nerve. Such an impact may also break the bones that surround the eye, and that may lead to fracture of the bones also. And the blunt trauma occasionally also results in the cuts or the lacerations to the tissues of the eye. Means there may be chance for the lacerations to the tissues of the eye. And coming to the clinical manifestation, depending upon the location, there will be different signs. One is the lid, means eyelid signs. The contusion of the lid may cause swelling and ecchymosis of the lids, and it is a condition known as the black eye formation. Then the conjunctiva, in conjunctiva there may be lacerations, and there is usually the subconjunctival hemorrhage will be there. Then the cornea and sclera, there will be cornea and sclera may be affected in the form of abrasions or rupture. It's minor injuries only. There may be abrasions or the rupture also. Then the iris and the pupil, that is iridodialysis. The iris may be torn from its attachment to the ciliary body, that is the iridodialysis. Then the lens, its concussion cataract and the cataract due to mainly to the damage of the capsule is the one of the resulting thing. Then the subluxation or the dislocation of the lens when a few fibers of the suspensory ligaments are torn, but it remains in the papillary area. Then the vitreous, means there are two chambers, vitreous and aqueous humors are there. So in the vitreous, there is disorganization of the vitreous and formation of the opacity, and the hemorrhage may occur in the vitreous. In the retina, there may be attachment due to detachment due to the tear in the retina, and the retinal hemorrhage due to the rupture of the retinal blood vessels. That is the thing. Retinal detachment will be there. Then coming to the treatment. In case of the mechanical injury, we have to immediately give a cold compression. That's one of the useful thing in order to relieve the hemorrhage and all. Then the subconjunctival hemorrhage usually disappears within 2 to 3 weeks. Then local eye drops like 5% Argirol are examples which we can use in case of these injuries, and the suturing means once there is a laceration that we can suture and create. Then atropine 1% drop may be instilled to give rest to the eye. Then the steroids eye drops locally may be using, and in concussion cataract should be removed by suction evacuation or by the extraction of the cataract. And a dislocated lens should be removed. Then vitreous, retinal and the choroidal hemorrhages require rest to the eye, and expanded treatment have to be given. These are the things in the management. And coming to the penetrating injury. Penetrating means once there is a from the first picture we also see that in such cases there will be penetration of some object into the eye directly. That is the penetrating or the perforating injuries to the eye. The perforating trauma refers to injuries in which the eye is pierced by a sharp object such as knife or a high velocity missile such as a piece of metal or bullets, pellets. These are the things which happens in case of a penetrating trauma. Usually we require surgery to correct the particular case, and the most penetrating injuries results in marked loss of vision and exhibit the following signs like hemorrhagic ecchymosis, that is the edema of the conjunctiva, then the conjunctival laceration, then shallow anterior chamber with or without an eccentrically placed pupil, then hypema, then hemorrhage within the chamber or the vitreous hemorrhage. Then coming to the treatment of the penetrating injury, there may be the patient is hospitalized with moderate activity restrictions, and rest of the eye is done by installation of the atropine 1% drop with eye bandage, and post-traumatic eye inflammation is minimized by application of the topical corticosteroid ointments. And a ruptured globe and the severe injuries with the intraocular hemorrhage require surgical interventions. And the vitrectomy is performed for traumatic retinal detachment, and the corneal opacity may be tackled by the keratoplasty. These are the common things what we are doing in such cases. And uh, first we have to limit the activities and all. Then we have to go for the surgical correction, and we have to advise for the rest also. These are the main things in this. And you know what is vitrectomy? That is the surgical procedure in which we'll be using the once there is a penetrating injury to the eye and there is any problem associated with this, then we have to remove some or all of the particles of the vitreous humor from the eye. That is the vitrectomy. Clear? Then coming to the next one, that is the foreign bodies in the eye. There are two. Foreign body means one, any of the external objects which are in which affect or which is inside our eye or not. That's the foreign bodies in the eye. Foreign body may be extraocular foreign bodies or the intraocular foreign bodies. You can see in detail. The main clinical manifestations are sensation of the foreign body in the eye. Then there will be sharp pain in the eye followed by burning and irritation. Then tearing of the eye. Then blepharospasm, that is a conjunctival congestion will be there. Then scratching feeling when blinking. Then photophobia. Then corneal abrasion. Then blurred vision or loss of vision in the affected eye. Then subconjunctival hemorrhage and difficulty in opening the eye. These are the common clinical manifestations. Then coming to the diagnostic, as you all know, we have to go with the history and physical examination, and we have to take the swab for identifying the further infections and all. And the fluorescence staining may be using. Means once we are not seeing the foreign body directly, then we can use the staining and we can identify the material and then we can remove this. Then the land microscopy and the ophthalmoscopy may be using. Then once there is any further complication, we have to use the ultrasonography also. These are the common diagnostic measures. Then coming to the treatment of the extraocular foreign bodies. As you all know, the simple things are the means when we are getting an foreign body in our, we will be doing all those things, and this include the we are not supposed to touch or rub your eyes, and this can embed the object more deeply and making it more difficult to remove. So we are not supposed to touch or rub the eye. Then wash the eye with plenty of water. Then both the conjunctiva and the corneal foreign body requires removal, and keep your eye closed as much as possible, and the blinking of only increases the irritation. So we have to try to reduce the blinking. And the conjunctival foreign body is easily removed by a sterile swab stick after application of the local anesthetic drops, and if foreign body impacted in the bulbar conjunctiva is removed by the hypodermic needle after topical anesthesia. Then the corneal foreign body should be removed with a swab or with hypodermic needle after topical anesthesia with 2 to 4% silocaine, and the antibiotic ointment has to be applied after removal of the foreign body. These are the main things in the extraocular foreign bodies. When coming to the intraocular foreign bodies, we have to actually check. We have to check whether it penetrates the eye or not, and localize the foreign body. Means we have to identify the correct location. We have to correctly localize the foreign body, and then we have to apply a patch, that is for 12 to 24 hours we will be using a patch, and then we have to remove the foreign body. These are the things we are doing in this intraocular foreign body. Then the chemical burns to the eye. Chemical burns means it may be caused by the alkalis or the acids, and depending on the chemical agent which is affecting the or getting infected to the eye, that will be producing different types of clinical manifestations, and which may be uh, scarring, perforation of the eye, and blindness are the common things in the alkali burns. And in the acids burn, the common symptoms are um, uh, the common there will be irritation and all, and they may lead to the blindness also. These are some of the things. And the common agents are sulfuric acid, then hydrochloric acid, nitric acid, and the acetic acid, chromic acid, and the hydrofluoric acid. These are the common acids which may cause eye burns. Means common uh, medical using things are also the highly dangerous substances. Then clinical manifestations in the earlier there may be pain, redness of the eye, irritation, inability to keep the eye open, then sensation of the something in the eye, then swelling of the eyelids, blurred vision, excessive tearing, and the photophobia. Then the common physical manifestation of the chemical injury, decreased visual acuity, increased IUV, then conjunctival inflammation, then particles in the conjunctival fornices, then perilimbal ischemia, then corneal epithelial defect, stromal haze, then corneal perforation, then anterior chamber inflammatory reactions, and the adnexal damage or the scarring. These are the common symptoms. Then in management, as you all know, we have to do the copier irrigation and all, and we have to try to remove the substance from the eye, and then we have to use the topical anesthetics or the sieve the cornices with the moist sterile cotton swab to remove any irritant foreign materials and all. Then debride the necrotic conjunctival tissue. Means once there is an acid active, there may be the necrotized tissues, and so we have to debride the necrotized tissues, and the epithelial healing is promoted through the aggressive lubrication, that is with the ascorbate replenishment, and the judicious use of the topical corticosteroids. And we can use the topical steroids, and which will decrease the reaction and all, facilitating the new epithelial cells growth and the ocular surface regeneration. We have to use also the antibiotics and all, and broad spectrum antibiotics we will be using, and we have to use oral pain medications in order to reduce the pain also. These are the main things. The last one is the radiation injuries. The radiation injuries mainly goes by the exposure to infrared, gamma, or the ultraviolet rays, and it is one of the common thing in due to the sunlight, snow blindness, and all these things. Then the clinical manifestations are after a period of 6 to 8 hours. The first symptom is marked foreign body sensation in the both the eyes, and this is accompanied by pain, lacrimation, and the blepharospasm, and the conjunctiva become congested. These are the initial signs and symptoms. Then coming to the management, that is with the adequate measures are to be taken to prevent the radiation injuries, and ordinary dark glasses can prevent lesions by infrared and the UV rays, and old compress a drop silocaine 4% atropine, and the steroid drops with pad and bandage relieve the symptoms. These are the main things. And then lastly, the complications. Complications include the corneal scarring, hyphema, iridodialysis, post-traumatic glaucoma, uveitis, vitreous hemorrhage, and the retinal detachment. And the complication risk is more with the retinal tears, penetrating injuries, and the severe blunt trauma. And lastly, prevention. Prevention, all those the things which we are already knowing, and uh, means we have to use the eye protective glasses while we are doing such activities and all, and we will be more aware of what the thing we are doing, and we should be more aware of the specific materials